And a very good afternoon, everyone. Welcome to a special edition of Issues and Attitudes. My name is Jeff Owens, Interim Director at WEIU. My co-host today is Lacey Spence. Welcome, Lacey.
Hello, hello.
Lacey will be hosting Being Well this summer at WEIU. And our guest today, we hope, Dr. Joseph Burton from Sarah Bush Lincoln. Welcome, Doctor.
Glad to be here.
All right. Sorry about yesterday. We had some technical issues here at WEIU, but they're all solved. We appreciate you hanging in. But I think in this important time, it was good to have you on and talk about the coronavirus and everything that's happening. And since yesterday, there was the first case of a Coles County resident was found in Coles County. So I guess as we will start off with that and your thoughts on this virus as we go forward.
Sure. We have been fortunate up to this point in terms of not having as many positive cases as other places at this time. Most of the positives obviously have been reported out of the Chicago metropolitan area and heavily populated areas, and so that's pretty consistent with, the nationwide trends. So we're fortunate that we've not been affected as of yet.
And so as we are kind of looking at our local response, what are some of the things that Sarah Bush has put in place? It seems kind of, I don't want to say ahead of the game, but since we haven't been impacted as hard, but how are we prepared?
Good question. The preparations initially for our hospital and our pre-hospital people started over a month ago when we started getting alerts and sirens from IDPH. And so we have already initiated pre-hospital protocols, screening protocols, and the hospital itself has already made plans of what to do with if we get overflow COVID-19 patients that are severely ill. What do we do with, all of our resources? How do we allocate them? How do we... It's been a flurry of activity, and there are a lot of people that have just worked long hours to make sure that we're in the best possible position if this gets a lot worse.
Now, you as a doctor, how is your workload and your hours? Are you being taxed, or are you okay right now?
In general, I would say that the emergency department staff, we've had lower than usual volumes and that's been a good sign, because that means that people have taken to heart, the message on a national level, statewide level, to stay home, to socially distance and do all those things, and no non-essential travel, etc. And so, in that sense, our volumes have been lower, which have been good, but we have also had a lot of sick people that have come in that were very, very, and rightly so, concerned that they may have been exposed. And what we've seen is a change initially from specifically being concerned about, hey, have you recently returned from Asia? Have you recently been in New York City? And now it's, been modified to, well, have you been in the Chicago area? And, now that's even modified even more to the point where we really are just asking, do you know of any positive contacts that you have been in close proximity to?
Mm-hmm. Okay. And can we kind of dive into that a little bit deeper? Because I know a lot of people are kind of questioning what testing looks like in Coles County, and some people may be getting frustrated if they've got these COVID-19 symptoms, but some cases maybe they're mild and they're not, able to get a test. Or what does that kind of look like? What are the parameters there?
Yeah, so that's a great question again, because that's probably one of the most frustrating things for patients that come to either our emergency department or even go to see some of our primary care physicians that are, catching some of these patients. And then we also have the respiratory clinic that we have set up in Mattoon. And so we get people that come in, and their expectations are that they are going to automatically be tested for the COVID-19. The CDC and IDPH guidelines have changed a little bit, but overall, the one criteria has been that if you are the walking well, if you have had a sore throat, but you don't have a fever, you've had a slight cough, but you look great otherwise, you're not hypoxic, you're not in any distress, you're otherwise looking fine, those people are instructed to go home, assume that you have it, and quarantine yourself. And so that's hard for those patients because a lot of times, again, there's been a lot of misinformation and wrong information out there that have set up expectations that are not realistic. Because, and it's not because we don't want to screen all these patients, but it's because we actually do have a shortage of the actual test kits. And so the state has actually put a pretty tight restriction on who should get tested. And it's important to realize that our testing method has been to try to get an idea of how frequent is the COVID-19 affecting our most severely ill patients. It has not been, the goal of it has not been to provide as a surveillance method in terms of, hey, we're going to screen everybody, and that way we'll find out for sure who all has it and how prevalent it is for sure out in the community. We haven't had the resources to do that. It would be wonderful to do that, but and it certainly would likely have helped control things a little bit better, but we didn't have the resources to do that.
Is it frustrating when a hospital and a state and even a country doesn't have the proper resources, like not enough testing kits, and we hear all about the gloves and the gowns, ventilators? I mean, how frustrating is it as a doctor to know that the supplies aren't there?
Again, and I listen to podcasts and webinars and live stream programs from the docs from New York City and from California. It's horrible. These guys are having to make life and death decisions. I've watched a couple of the programs put out by some of the other news agencies out there that have gone to Italy, where the death rate was just sky high, and they've finally numbers are starting to level off, but physicians just breaking down emotionally, physically, long hours, all of those types of things. It's been horrific for those places where they've had to deal with the epicenter of some of these outbreaks. Again, for us, we have been fortunate that has not happened to us yet. And I will say that with all the shortage of supplies that we've had, we have had fantastic support from community, from local businesses to help us get gowns, makeshift gowns, masks. We've had community members that have made over 1,000 handmade masks for the hospital and patients. All of that has been greatly appreciated, and it's really been neat to see that kind of a response from the whole community. But yes, those types of things have been terrible for a lot of the people that are on the front lines.
Yeah, and before Lacey's question, the Libman company just last night 20,000 surgical masks donated to Sarah Bush Lincoln. So that's an Arcola-based business, and I'm sure you're very appreciative of those folks.
Oh my gosh, yes. And I mean, we've even had some of the local businesses that have actually been sending the hospital staff, food around the clock. And so, again, it's been very, very appreciated.
And so, as other people are, watching maybe larger news organizations, hearing, maybe in New York where ventilators are in short supply, where our own governor is saying that, we're requesting ventilators from, the federal government, not quite getting as many as we'd like. How is Sarah Bush stacked up and prepared. Are we good?
Yeah, we are. We currently, I don't believe we have any known positive COVID-19 patients that are on a ventilator currently. We may have, I believe, maybe a screen that we're waiting on one patient, but currently we do not have a ventilator shortage. We have run tight a couple of times with some masks and some gowns, but again, we have been fortunate enough that we did get supplies from the community as well as from our suppliers, and again, we're in a much better position than a lot of other hospitals at this point.
We're talking to Dr. Joseph Burton of Sarah Bush Lincoln. It is so good to see the community and the citizens working together here in the Mattoon-Charleston area. What are your thoughts on what you've seen this last 3 weeks here in our county?
Really, I've been impressed with the fact that for the most part people are listening to the instructions coming down from CDC, IDPH, and it's been interesting because the messages have been modified from day one when the pandemic was officially recognized to where it's at right now, and so there certainly was a little bit of it could be easily understood why people would be a little bit confused of, hey, am I supposed to wear a mask, not wear a mask? And currently the current recommendations are saying that we want everybody masked. And so that's what we're doing in the hospital. That's what we're recommending for everybody else out in the community. I know that I think the last time I had to go to the grocery store, I think I was seeing more and more people wearing masks, but I would really like to see that occur even more, and people do that because, again, the prevention of this, the prevention of the spread of it will be directly related on how well we do the simple things that are very effective in stopping the transmission of the virus.
Sarah Bush has also put into place some special rules. If you do have an appointment out there for anything, about checking in, taking your temperature and stuff, could you go over those and what people need to know if they're going out to Sarah Bush?
Yeah, what we basically try to do is we have restricted the number of visitors and we've discouraged visitors if at all possible. And we will screen you and check your temperature, and we will ask you to put a mask on. And if you have a underlying respiratory illness and that you can't tolerate a mask, then what we'll try to do is put at least a face shield or something over you so that you're protecting yourself as well as protecting others.
Okay. Lacey?
Yeah, it's it's great to hear that the hospital's taken such lengths to protect everybody. And I wanted to kind of ask you a little bit about the medical surge facility that the Lakeland College Fieldhouse recently renewed that agreement. What is the purpose of that? Pretty much, I know that we are doing fine on cases right now, but what does it look like down the road if, worst case, we need to put that into motion?
Yeah, so that facility, as well as, we have, I don't know if you were aware or not, but we have what is called the Mavis tent out in front of the hospital. And that, both of those areas are essentially set up so that if we get to a point where we have overflow and we have a high amount of patients that start coming in, we have places where we can potentially screen these patients. And I'm sure you've been watching the news where there have been all kinds of solutions that people are their Army Corps of Engineers have set up, temporary tent hospitals next to big tertiary centers because they're just simply overwhelmed with the COVID-19 patients. Mm-hmm. I know up in Birmingham, Michigan, hospitals are saturated. They've had to close down their OR suites and use anesthesia machines as ventilators. So there's all kinds of solutions that people have come up with for their particular area. Again, I think that we're as ready as we can be. It's no telling if this does get worse. I feel like we've done our due diligence to try to be as best prepared as we can be.
Oh, definitely.
When you talk to your colleagues in the industry, at Sarah Bush or across the country, I mean, do they feel the same way, that everybody should be doing the mask, should be doing social distancing, staying home in shelter, and following all these guidelines, or do they think it should be next level and even stricter?
Most people, I would say, fall into that. They know that just following the hand washing, social distancing, and simple masking should be able to bring this under control. The bigger question that you're asking of whether or not it should be stricter and all that, I would say that there is feelings amongst some of the people that I've spoken with that there likely should have been stricter guidelines addressed for some of those areas that have, now blossomed into epicenters. But easier said than done.
Good answer, Lacey.
What do you think? What do you think things look like once this sort of dies down? When lockdowns and whatnots are starting to be lifted?
Yeah. So if you guys have listened at all to Dr. Fauci, who addresses on the national level, one of the concerns that all of the infectious disease people have is that if it's one of those things, if you let off of the guidelines and let off of the gas too soon, then what will happen is that you potentially get a second or third wave of the spread of the virus. And so that's where, even though the numbers are potentially getting better, if you, say, I'll give a for instance, so Saturday, I believe new cases reported for IDPH for state of Illinois was 1,453. Sunday, new cases reported was 899, and then new cases yesterday was just like 1,005 or 1,003 or something like that. Yeah. The bottom line was that that's a downtrend, but which is encouraging, but we don't know if it's going to stay there or if it's going to go back up yet. If we have 2 weeks of that, then we could sit there and go, okay, we're making progress, we've got to keep going. If somebody said all of a sudden, okay, it's lifted, you guys can, I would tell you those numbers would go right back up.
Because a lot of people are saying the next 2 weeks are just absolutely critical time for the country.
It is.
Do you agree with that?
Yep. I do.
So people should really be as strict, and you're really asking for everyone to be masked, is what I heard you say earlier.
We are. That's the message that we've told our employees and anybody that comes into the hospital and anybody that comes into any of our ambulatory clinics, and that's the message that we would like to put out there for the rest of the community right now is mask up.
Okay. What do some of the patients, you got to be careful, but what are the patients most, when you're meeting with patients one-on-one, what is the most common question that they're asking you? Try to dig a little inside of what people are asking you.
Oh, the most common thing is, just simply the fear that they have the COVID-19. And so, again, that's sometimes, a very, very difficult position to be into because, excuse me, everybody, has concerns that nobody wants it. They, have all kinds of reasons. They have their own family members that they're worried about. They're worried about themselves. And if they're clinically doing well, we're stuck in that hard position of saying, hey, look, I know you're fearful of this, but, you don't have a fever. Your physical exam is normal. I think you can just go home, and you've just got to monitor yourself closely. And if you get a fever, if you get a cough, sore throat with the fever, then, let us know, come back, go to your primary, then have them decide if it's time to try to test you or not. And so those are probably kind of the biggest concerns. The secondary concerns are if, it's concern for their family or loved ones that they know that could be harmed if they got it.
Okay.
And so they have the fear of transmitting it to their grandparents, to somebody that they know that has cancer, et cetera. Those are the what I've seen really difficult positions that people are put in.
We're talking with Dr. Joseph Burton of Sarah Bush Lincoln. We have about 7 minutes left with you, Doctor. Before I get to Lacey, I want to make sure if there's anything that was on your mind that you wanted to get out to the public, give you a couple minutes here to say that before we get to Lacey's next question. Doctor, is there anything that you want people to know about from your point of view?
I would just encourage our community to keep it up, because right now, the fact that we currently just have one case is good. And even though we've had our first positive reported, if we do all these things that are in place, it won't spread any further. And I would just recommend people to keep up, mask up, wash their hands, keep their social distancing, and those simple things can really stop this transmission.
Okay.
That staying disciplined, as people are, they're canceling their weddings or birthdays.
Oh my gosh, yes.
It's hard to see, but it's nice to see people unite and find, I guess, creative ways to practice what you're preaching.
Yes.
In this time. Yeah. So you're kind of higher up in, medical community. What are you hearing as far as maybe a vaccine or anything, future tense for this?
Well, the best estimates that have been put out there by the CDC are that we would be at least a year and a half at the earliest to a vaccine.
Wow. Did you ever think that this was happening? Is this something that, when you were doing your studying and in college to get your degree, is this part of the process that pandemics are out there, and that did you think you were going to be involved in one?
Well, all of us have known that it's out there, and it's actually made me do a little bit more research into the Spanish flu outbreak in 1918, which was very interesting to read about because it occurred during World War I, and so all the countries that were fighting one another, the militaries stifled the outflow of information of all these flu cases that were breaking out, and so it propagated the spread of the influenza, and it was very, very interesting learning about how that was handled, and it became named the Spanish flu because Spain was a neutral country at that time, and their press was the only people that were writing about it and letting everybody know about it, so everybody just assumed that it was only in Spain. And so this coronavirus we've known about because it's in the same family of viruses that caused the SARS outbreak, the MERS outbreak, and so we have known about it. We just have never had to deal with it on this scale. And so, and to answer your second part of your question, no, I had no idea that we would ever get to this level on a national level here.
Lacey, have a question? Or?
Just if you look further into the future, your little disco ball, typically summer, a lot of our cold and flu season dies down. Any projections as we move forward into late this year?
I am hopeful. I am hoping that this is all under control and that we begin to return to some type of normalcy, maybe July or August. I mean, those have been the most conservative estimates that I've heard out there, and that was actually put out there not only by Dr. Fauci, but by some of the other leading infectious disease people.
Dr. Fauci has kind of become a doctor superstar over the last couple of weeks. Of your thoughts on his work in Washington.
He's been doing wonderful. He's in a very, very tough position. But I think he's doing the very best he can.
Are you disappointed that politics got involved in this, and that we're, instead of just working on making things right as a country, we've got politics all over the board?
Yeah, I mean that's and that's a discussion for a whole other day. But yes, I mean unfortunately there will be some type of reckoning for all of that, because unfortunately there have been people that have had to suffer because of that.
Yeah. The other thing, the other thing that's really came out about this is the essential and non-essential people who have to go to work or not go to work. At some point, if things don't get better, do you think we're going to have to relook at that list? And I know that affects the economy and everything, but we have to get this solved in some way.
Yeah, I mean, I don't. If it gets worse, I don't think anything's off the table.
Okay.
Yeah.
Couple of minutes left with Dr. Joseph Burton from Sarah Bush Lincoln. We appreciate you coming in today, or calling in. We can't have you come in because of social distancing, but we appreciate you calling in. How do you stay positive as a doctor at Sarah Bush when you're going through this crisis? And I know we're on a smaller level, but it's still a crisis here in this country. How do you stay positive, sir?
Well, I'll tell you, the things that have made me stay positive are the people. Most directly is family and friends and people that I work with that are being positive, or that I've seen just go above and beyond and just sacrifice their own time, their own energy to, I could probably, again, talk to you for another half an hour of nurses, doctors, hospital staff members that have filled in shifts, that have gone and gotten us supplies, driven after their shifts to go get stuff. I mean, I could go on forever. And those are the things that really make you feel good about stuff and optimistic, because you see that people are really doing everything they can to help and to put us in the best possible position.
Got about a minute left. Lacey, any final question for Dr. Burton today?
Just for folks at home that want to help out, is there anything that people can be doing?
Really, I would just drive home the point of...
just drive home.
Yeah, just stay home. Just drive home, stay home, and mask up and wash your hands and do those simple things.
Well, we appreciate you calling in so much today, Dr. Burton. It's been a pleasure. Apologize again for the technical difficulties yesterday, but
no worries.
I believe our listeners and viewers on our different platforms will enjoy this show, and hopefully they learn a couple of things. And I say this with the kindest of heart. I hope we do not have to talk to you again for a few months. All right?
That would be wonderful, and if we did, hopefully it's on a happy note.
There you go. Well, tell everybody at Sarah Bush, thank you, and keep fighting the fight, my friend.
Will do.
Thank you.
All right, bye-bye.
We are WEIU.